Okay, let's talk about our patient today. Our patient today is a dentist. Young lady, a preeminent lecturer, a dental hygienist from Bulgaria, Buffalo, New York, Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers, 8 Lumineers, 10 Lumineers, 6 Lumineers, 10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient. And now we're not treating teeth anymore. We're treating smiles. Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. What we're going to do in this young lady today is we're going to place 10 Lumineers on her teeth. You're going to get a condensed version of it, but you're going to see what has to be done and can be done if you're prepared to do it in your office and have everything set up. I've been doing these for over 20 years. There's clinical studies showing they last 20 years. There has not been one debonding in the 20-year study that Howard Strassler is following. He's had some chips on them, and those they replaced, but there was never a debonding. Let's talk about our patient today. See, we used to talk about tooth and teeth. Now we don't talk about tooth and teeth anymore. We talk about one smile. And her smile is going to have 10 teeth in it today. So what we did do for her is a try-in. She does not have ugly teeth. She has an attractive smile. She's a very attractive lady. But people can become more attractive once they find out they don't have to have their teeth ground down. So with that, let's get started. And the first thing I'm going to do is put some Paint-On Dental Dam on the lingual side of her teeth. Now what I'm doing is putting Paint-On Dental Dam, the blue shade, over the lingual surfaces that I don't want Ultrabond to bond to. That facilitates the cleanup, and wherever I have the blue, I know that Ultrabond won't stick to that surface because the blue Paint-On Dental Dam got to it sooner. Now close your eyes. And I'm taking the sapphire light, close your eyes, at about 1 inch for 3 seconds to polymerize to a rubbery state the Paint-On Dental Dam. On the enamel of each tooth, I like to use a medium viscosity with aluminum oxalate. That way, when I'm doing my regular operative work, if I expose it or get it on the dentin, the aluminum oxalate will help desensitize and seal the tubules. We're not in a hurry. If we could take longer, we would. Okay. Now the reason I like tenure AB is it's not light dependent. You want to keep that clean and dry. Which one? Left central. Lisa always calls out the name of the tooth, not the number. And this is the try-in paste?
Yes.
Okay. And this is the B0. Okay. Now we'll give the patient the mirror, and you can tell me if you like the shade on the left better or the shade on the right better. You like the white one, okay? What I'm doing right now is I'm removing the try-in paste and coating the treated surfaces with Tenure S. And once I get the try-in paste off, I want to cover all of the prime surfaces, the ones that have the tenure and the etching on it. Now we have protected them against contamination. we're using the Supreme White. Is that correct? And when you try these on, they don't look like they fit like a cast gold crown, where we used to rely on the precise fit, right lateral, okay, of the casting to protect the washout of the cement. Because you see, our cement is really a restorative, and the porcelain is nothing more than a matrix. And we'll brush most of this off. Now, if you don't get all of the Ultrabond try-in paste off, the tenure S will cause it to polymerize even without the light. So it's backup. Now we take the 2mm tip for 1 second and fix this in place. Close your eyes. What I like to do is place the tip and close my eyes and hold it in place with a finger rest. If I didn't have 4-power magnification, I can tell you these things would really be difficult. But with 4-power, it seems like I'm right down inside the buccal vestibule. We have secured the veneers in place, but we haven't finally cured them. So I'm going around and removing a lot of the excess. Okay, that's good, because I only cured the center. And so then I start wiping this off. Then we take the tenure S on a cotton pellet, and we just go around and wipe off most of it that we didn't take with the brush. Okay, I'm going to take the 9mm tip for 5 seconds and cure. Close your eyes. How long would it take you to prep 10 teeth for traditional veneers, take impressions, and make temporaries? See, we didn't even have to make temporaries. We didn't have to give the patient any anesthetic. The only part that's uncomfortable for her right now is having her lips pulled apart. But she doesn't know what she's missing. Okay, we have just bonded 10 porcelain veneers, 10 Lumineers to her teeth. So now we're going to remove the paint on dental dam that we used to isolate the teeth. And now I'll start blending the Ultrabond, the porcelain, and the tooth structure all together. They're one homogeneous piece. So what we're going to do is modify it and contour it to give us the shape and the contour that we want. Now I'll show you what it looks like on the lingual side. Okay. That's mostly cleaned up. And then we'll take the 12 fluted burr and we'll remove the Ultrabond on the labial side of the teeth. And I'm using a 12 fluted burr because it won't affect the porcelain. So this is the beginning of the finishing on the labial surface. And if I touch any sensitive tooth structure, you tell me. See, now if a patient was numb and you were finishing, they would never know, and you would never know until after the anesthetic wore off, how much, and usually it's quite a bit, of sensitive tooth structure you ground away. Okay. Now we're going to take the Sure 349, and all of these instruments are in the Lumineers Clinician's Finishing Kit. It looks like an orthodontic, like a scaling instrument, but you'll never be able to scratch the glazed porcelain. Let's take the marking paper now and see where we are. Anatomy, close. Let's take a look at her occlusion. See if we have any high spots on here. Okay. what you want to look out for are occlusal marks on the porcelain. There's a chunk back here. And then you want to take that off. Okay. And we'll do that again with some more gauze. Now, I can't emphasize enough how important occlusion is. Close. Grind around. Grind your teeth. Open. So now I go back in and I gently blend the porcelain to the tooth structure so that I won't have a shoulder, or she won't have a shoulder. And because I remove the ultrabond and I have 4-power magnification, I can tell the right amount to take off. Now we're going to take the seri saw. The seri saw, I forget what the micron thickness of it is, but it's about as thin as you can be and have it be a solid mass. And these are going to open really nice and easy today, but you want to get all the ultrabond out first, because if you have trouble opening a contact, it's because there's too much ultrabond in there. Now I just start gently sawing through this. See that? Now if you get into a tight spot, stop sawing, start rocking. See this, what I'm doing right now? Pardon? Oh, okay. And we'll try this over here. And I only open the easy contacts on this visit. Now we'll take the seri sander. It's a safe-sided disc, or strip. Orthodontists use it for opening contacts. And I just go through and sand it after I've gone through with the seri saw. Okay? And that allows the floss to go through nice and easy. Now the contacts that I don't open today will be very easy to open a week from now. This is all that you have to do, and I'll open the rest of her contacts on her next visit. The same way I open these, probably half of them will be open anyway. We checked your occlusion, and now you get to take a look. What do you think of that?
I love them.
You sure now? I'll take them off if you don't like them.
I like
Okay,
them.
all right.
Oh,
Isn't that amazing? And with that, I'd like to bid you adieu and hope you have a good convention. Have a good day.
Growing up, I had the staining on my teeth, the spots from over the too much fluoride treatment when I was a kid. And so that was one thing I wanted to cover up with the Lumineers. I wouldn't have got anything if I had to get my teeth ground down, because if I didn't like it in the end, there's no way to reverse it. When I came to get the Lumineers, I was very nervous. But once he started, I didn't even realize he was doing anything to my teeth. After he was done doing the Lumineers, I couldn't believe it was done, because it went by so fast and it was painless, and I just thought he still had work to do. Everything I wanted to get out of my teeth and out of my new smile is exactly what I got.